Hey there, YouTube fans. How you going, man? Hey, I got diagnosed with fibromyalgia. It's very, very similar to chronic fatigue syndrome. They share a lot of overlapping symptoms, and as far as I'm concerned, the jury's still out whether I actually have both. I don't seem to have... One of the clinical features is, I'll show you this little diagram here. You see these little tender points? If you push on these points, that causes pain. I don't have that. That's the only thing I don't have. Pretty much everything else I have. And there's heaps of videos on YouTube about fibromyalgia. This is a GP's textbook that students use. And it says here the main diagnostic features are a history of widespread pain, neck to low back, pain in 11 of those 18 tender points that I showed you there on digital palpation, which is like pressing on it. These points must be painful, not tender. And other features are female to male ratio is 4:1. There's 4 more women than men that have this. The usual age onset is 29 to 37 years old. The diagnosis, though, comes at 44 to 53 years old, which is where I am. Poor sleep pattern, yes. Dermatographia, not sure what that means. It could be when you have... in your hand, it can show up as red parts on your hand and then white, which is poor circulation. That can be a symptom of fibromyalgia, but I could be wrong with that. Fatigue, similar to chronic fatigue syndrome. Psychological disorders like anxiety, depression, tension, headache, irritable digestive system. This disorder is very difficult to treat and is usually unresponsive in the long term to passive physical therapy or injections. Patients require considerable explanation, support, and reassurance. And this is interesting. Best evidence to date supports the value of educational programs and regular aerobic exercise. With this one, it does seem to be lifelong, though. There's no cure, there's only treatments. It says here, explanation for treatment, explanation, reassurance, counseling, attention to the sleep disorders, stress factors and physical factors, relaxation program, rehabilitation. So this is interesting here. It says graduated exercise program of walking, water exercises, swimming or cycling. So it actually says to do exercise, but if you have chronic fatigue syndrome, exercise can make you a lot worse. So that's interesting. It says here to use paracetamol for pain relief, and I know that cannot work at all. They do use antidepressants. They can use amitriptyline. They can use dothapin and duloxetine. NSAIDs, which is non-steroidal anti-inflammatory drugs, are of no proven benefit. Also, always check with your doctor because you could miss something serious, even more serious than that. I did see the hospital rheumatologist, and they said you fit the diagnostic criteria for fibromyalgia. I said, are you sure it's not chronic fatigue? And she said, no, I'm saying fibromyalgia. But I don't have those pressure points. I'm not sawing those pressure points. So that's got me confused a lot. But I do have post-exertional malaise or something that presents like that, but that is possible under fibromyalgia. See, they're very, very similar. They share all these same symptoms. However, over the fibromyalgia side for me is I do have temporomandibular symptoms or jaw problems in the joint. Oh, it's hot here. And that is a symptom of fibromyalgia. So it is possible, for example, that I have both. I am going to talk to another specialist tomorrow, another rheumatologist, because I had that booked before the other one, actually. So I wanted to get a second opinion. Also on the LDN, low dose naltrexone, I've got to say, wow. Okay, so first of all, I woke up with no pain all over my body. My back doesn't hurt. However, I think my neck was hurting, and I've had a headache and I've had nausea. I'm taking better stop playing with that rubber band. I'm taking 1.5 milligrams in the morning, say 9 o'clock, and then another 1.5 at 3 o'clock. And I've split it up that way because I seem to have this benefit. I get pain relief and everything feel good, and then it seems to wear off. So I do it I take another one at 3 so that I have some more waking hours of pain relief and that, and then I can go to sleep. But I had vivid dreams again last night, which is a side effect, kind of a nightmarish kind of dream, but it doesn't bother me, like, I don't care. It's interesting, to be honest. But the headache and the nausea, that does kind of concern me. Now, that may go away after using it a bit longer. So it's still early days yet for me, and I don't feel terribly great. I'm not feeling very well right at this moment, actually. Anyway, we'll see. I mean, I could take it back even further, but I'm really stubborn. That's me, okay? I kind of sometimes I put up with side effects because I'm used to it. But you probably, if you didn't want the side effects, and I'm not saying that you should be doing this, but I should have titrated that back down to 1.5 milligrams possibly. We'll see if I do that, if I get ill enough. And I don't know what day this is. Somebody can tell me what day this is on low-dose naltrexone. But I got to say, I felt good enough this morning, besides the headache and the nausea. And the nausea, by the way, is helping me to eat less. So it's like a two-edged sword, isn't it? But anyway, I felt good enough to go for a long drive. But it's so unpredictable, guys. That's the story, eh? Anyway, so we have from the hospital, the hospital rheumatologist, that I have fit the diagnostic criteria for fibromyalgia. They're going to refer me on to a pain clinic. It does explain why I have also dry eyes and dry mouth. That is a symptom of all of this business. There's all these symptoms that I've had, like I said, the jaw, the fatigue, and why stress can make. So trying to start a new job, and then I've had this massive relapse, which they call it, if you got fibromyalgia, they call it what's it called? So the crash is in CFS. I can't remember. I don't remember. Some kind of crash thing as well. That's why you see me sometimes going in my videos, because I got a dry mouth. It's all part of that whole. They think it's central nervous system sensitivity, something like that. It's basically all neurological. Most of it's neurological, and they said on my research that it can be autoimmune as well. That's what my student doctor mate said today. That makes sense. There's no cure. There's only treatments, and the treatments are hit and miss as well. So fibro can be a lifelong illness, but chronic fatigue, it says in this doctor's manual, I mean, I swear these things are old, even though this was a 2021 version. It says that it can be cured in 2 years, chronic fatigue, but 95% of people don't get cured. So I don't know what, this is the thing that probably doctors themselves are frustrated about. There's so much conflicting information out there. I don't think that's up to date, even though it's 2021 info on that. See, that's a student textbook too. That's the frustrating thing. All right, guys. Well, I'll leave it there. That's where I'm going. Remember to like, comment, subscribe, give to save the children, to help the poor Ukrainian kids. And I'll see you in the next one. I'll keep you updated, okay? Take care, guys. God bless. Teacher Cell out.